So let's talk about Medicaid because I went back. You and I have talked about it. I've talked about it with other members of other Democratic members of Congress, Republican members of Congress. And I went back and I asked the House Energy and Commerce Committee, which oversees Medicaid. And I asked about, as far as the Medicaid cuts. I was told that the Medicaid budget is still going to grow. It's just the cuts are from the growth, not from the original budget. Is that true? That's what I was told. That this,
That's not my understanding, but they're cutting a budget, and they were given a directive to cut $860 billion out of that budget for Medicaid, which is going to kick 16 million people off of critical health insurance. It's interesting. The chambers, Dallas Chamber was in my office today. Businesses across the country, so many advocacy groups, everyone is opposed to these Medicaid cuts. The only people that are pushing it is Trump, and now Republicans are acquiescing to that because it only benefits Trump and his friends. But I think kicking 16 million people off of health care is not a good way to go.
and because I've asked Republicans about it, and they say what they're trying to focus on is pregnant women, the poor, and the disabled, and able-bodied people. They say should certainly have to go and work at least 20 hours a day in order to get benefits.
Mm-hmm.
What's wrong with that?
Well, there's nothing wrong with able-bodied people. The problem is that our minimum wage is $7.75 an hour. The problem is that you can work 40 hours a week in the state of Texas and still be Medicaid eligible because of the income requirements, because they didn't expand it to the higher rates. And this is ridiculous. Medicaid predominantly supports women and kids as it is. And so they're just cutting money out of it. They're cutting benefits. Rural hospitals in Texas are going to close. The Hospital Association in Texas and across the country, the Medical Association, every medical group has been in my office very concerned about these Medicaid cuts. It's what it's going to do to their patients, what it's going to do for their ability to provide care to people in Dallas, people in Texas, people in rural Texas. And they're very, very worried about it. And I'm listening to them.